Chapter 1. What is xanthelasma? Xanthelasma, called by specialists Xanthelasma palpebrarum, is a particular type of xanthoma, a yellowish deposit of fat underneath the skin, usually on the eyelids and or around them. Therefore, xanthelasma can be referred to as xanthoma, but not vice versa. The process in the formation of xanthelasma and xanthoma are the same, but we refer to xanthelasma only once the xanthoma develop around the eyes or on the eyelids. Xanthelasma are composed of xanthoma cells, which are foamy formations which intracellular fat deposits primarily located within the upper reticular dermis and epidermis. Put more simply, xanthelasma are collections of certain types of fat, mostly cholesterol and triglycerides derived from food. Illustration 1. Xanthelasma appears on upper and lower eyelids. These lesions appear in those individuals whose body is unable to efficiently break down fats into usable energy. Sometimes diabetes, hypothyroidism, liver problems, and mostly genetics can all contribute to the growth of xanthelasma. Recently, the role of LDL and macrophages with their scavenger receptors has been observed as a probable causation of xanthelasma palpebrarum. Since xanthelasma are fat formations, they have little nervous terminations, therefore they are not painful. The incidence of xanthelasma in the general population has been reported between 0.3% and 1.5%. The age onset ranges from 15 to 73 years, with a peak incidence in the 4th and 5th decade. Throughout our experience in treating this condition, xanthelasma appear to be lesions predominantly observed on female adults. Although this higher reported incidence has been corroborated by independent studies, this may be due to the fact that women are more self-conscious of cosmetic conditions than men. Due to the type of customers we have served, we can now say xanthelasma are equally common in Asians, Caucasians, and people from any ethnic origin. Many still believe that the formation of xanthelasma are directly related to the cholesterol levels of the individual, contributing to the development of the condition. However, a direct correlation between high lipids levels and the formation of xanthelasma has not been proven. It has been found that many of those developing xanthelasma have normal cholesterol blood levels. Illustration 2. Xanthelasma on upper eyelids. It seems instead that certain individuals are more likely than others to develop xanthelasma, mainly due to hereditary factors. This is confirmed by studies conducted on a large number of people who developed the condition. It has been found that the high cholesterol incidence level of the xanthelasma sufferers is close to those of the normal population not developing xanthelasma. Therefore, unless proven otherwise, it is possible that high cholesterol levels and the development of xanthelasma may not be directly correlated. On the contrary, there seems to be a hereditary component which contributes to the development of the condition. Hence, should a close relative be affected or was affected by the condition, you will be more likely to develop xanthelasma despite your cholesterol levels. Only when there is no family history of xanthelasma, the condition could be related to high cholesterol levels. Illustration 3. Xanthelasma on the upper and lower eyelids. The xanthelasma condition is usually assessed by family doctors and dermatologists. However, given that there is little research done on xanthelasma, the advice offered by many not be in the best interest of the patient. In fact, some practitioners have advised their patients that it is too risky to have their xanthelasma treated because they could end up being scarred in the process. This advice had been offered because there is no inherent health risks in keeping the xanthelasma benign growths, and little information is available on how to have xanthelasma properly removed. However, it has been proven that when removed with the latest treatments, the risks of scarring are remote. For a long time, xanthelasma have been referred to as an indicator of potential high risks of cardiovascular disease, strokes, and heart attacks. However, to this day, no scientific study has been carried out to corroborate the link between xanthelasma formation and cardiovascular diseases. Nevertheless, many still say that those affected by xanthelasma are more likely to die younger due to heart attacks or strokes. Initially, this alleged higher mortality of those affected by xanthelasma was believed to be due to the high cholesterol levels of those affected by xanthelasma. Illustration 4. Xanthelasma on the upper eyelid corner. After all, the common belief was that high cholesterol levels caused the xanthelasma formation in the first place. However, no evidence of this has been found, especially given that the cholesterol levels of many affected by xanthelasma are normal. A study was carried out showing an association between xanthelasma formation and cardiovascular disease. In this study, it is shown how similar the xanthelasma and xanthoma development process is to the formation of plaques within the arteries. Lately, a study has associated the formation of xanthelasma with a 17% greater risk of mortality due to cardiovascular diseases when compared with those without xanthelasma. Xanthelasma appear on both eyes symmetrically in the vast majority of the cases. It has not been reported a case of xanthelasma on one eye only without the other eye being affected. However, it has been reported of people who developed xanthelasma without ever developing xanthelasma and vice versa. Although xanthelasma are skin lesions, fortunately, usually they are relatively superficial and they do not grow too deeply into the dermis. Illustration 5. Xanthelasma appears on upper and lower eyelids. Xanthelasma usually reside between the superficial part of the dermis and the epidermis in the same fashion as common warts. Therefore, the successful treatment and removal without scarring is feasible and not uncommon.